those of you who are joining us today for this webinar. As we've been learning, surveys are corroborating what many on this call know from their own experience and their work with community members. COVID-19 has been and is continuing to take a toll, not only on health, but is causing serious hardship. Since March 2020, Propel has surveyed its FreshEBT app customers monthly to gain insights into their experience during COVID-19. We appreciate the fact that Propel has been sharing those top-line findings from their surveys for several months with us, and are with us again today, the Propel team, to share the results of the most recent survey. Please use the Q&A box while the webinar is proceeding to submit questions or comments, and we'll try to get to those at the end after the remarks. I'm going to turn it over to Stacey Taylor, Propel's Head of Partnerships and Policy, and thank you, Stacey, so much for joining. Please let us know what you're finding from your most recent survey.
Wonderful. Thank you, Ellen. And it's nice to connect with you all again today. We will be sharing the January survey results and trying to do some comparison between what we saw at the end of last year and what we're starting to see at the beginning of this year. So it'll be a very familiar format. For anybody who is new to the webinar series, we are with a technology company named Propel that builds modern, effective technology for households that are interacting with the SNAP program using an EBT card. And our tool is called FreshEBT, and you see FreshEBT here on this screen with the function to check and manage benefits that are distributed through an EBT card, SNAP benefits, and cash assistance, and to provide other relevant information at that point in time to help to improve financial health. This is also how we distribute the survey results that we will go through today. So we have been distributing this survey monthly since March of 2020, and we typically survey around 5,000, sometimes a little bit more, sometimes a little bit less each month, of the 4 million households who are using FreshEBT. The households using FreshEBT look similar to the overall SNAP population, distributed geographically. The user base tends to skew towards being more likely to be a mom with kids at home, and happy to dive into that more as well. But we see that's the population using FreshEBT, so the population answering the survey skews that direction too, as compared to a sort of average SNAP participant. The survey results that we will go through today were collected January 1st to January 14th. We just closed our February survey, so can sprinkle in some of those findings, but we'll sort of loop back with another webinar fairly soon to present the February data as well. But every household responding to the survey elects into the survey and is a current EBT cardholder. The January results will also sound very familiar. It's really bleak. Just about every single household responding to the survey using FreshEBT is facing some type of financial hardship. We see wide-ranging economic insecurities, food insecurities. The ray of light this month is that we are seeing positive impacts reported, in particular for households who have received the EIP payment. So again, we're seeing this story of government response works. When we provide cash assistance and increase SNAP benefits, we see reduction in economic insecurity. We still see very high rates of borrowing, in particular borrowing from family and friends. And a new question that we can share this month is we asked folks to reflect on how they spend their SNAP benefits has changed since last March. So I'm going to introduce my colleague Julieta, who will go through the results in more detail. Julieta has been working behind the scenes on these survey results for several months. So excited that you all finally get to meet her. I guess we can call it face-to-face. So Julieta, I'll turn it over to you now.
Thank you, Stacey. So my name is Julieta Coyat. I am the Policy Research and Communications Manager at Propel. Noe, could you bring us forward to slide 4? Yes, Thank you. So these are the high-level results that Stacey just summarized. And I guess I will go ahead and dive into the first one, if you can bring us to the next slide. Thank you. So if you attended maybe the December webinar on those December results, what you heard from us was that there was an overall trend through the fall of worsening results in terms of the food insecurity measures that we asked people about. And what we see in January was that there was a slight leveling out of those indicators. So, a percentage point decrease, perhaps, not anything huge, but at least things aren't getting worse for people in terms of, the way we ask this or measure this is by asking people if in the past 30 days they've skipped meals, eaten less, relied on a food pantry, or relied on others for meals. Housing uncertainty is something that we also ask people about month after month, and it didn't really decrease from December to January. So still remaining at a pretty high level. 41% of people say that express some level of uncertainty in whether or not they'll be able to stay in their housing, despite the fact that at the end of December, we saw an extension of the federal moratorium on evictions. As Stacey mentioned previously, for those who received the second economic impact payment, we see a bigger drop in food insecurity measures. Still not very large, but it's with housing uncertainty that we see the biggest drop. If you could take me to the next slide. Thank you. So we asked people who received that second economic impact payment how they spent it, and this explains the decrease in housing insecurity. Most people, the vast majority, spent the second economic impact payment on paying bills, paying rent, those big ticket items. And next, people are buying items that they can't get with SNAP benefits. And third down the list is food. And you can see how the breakdown continues. In January, again, the first 2 weeks of January, only 30% of respondents had received a second economic impact payment. And we see, in February, as Stacey said, that survey just closed. We have some preliminary results. It's jumped up to over 60% now report having received it. But families needed this money months ago, really. So they were in a pretty desperate situation, and whether they had to wait 1, 2 weeks, a month, or more, every moment matters. And unfortunately, we see a racial disparity on who received the second economic impact payment sooner than later. Black respondents were much less likely to have received it in January, 22% versus 38% of white respondents. There's also a disparity with Latinos, not quite as stark, but 30% of them had received that second payment by January. And families with children also, respondents with children also had a rather large disparity in not having received that second payment. And, we also asked people how they received the payment. Predictably, it skewed very heavily towards those who got it via direct deposit versus getting a debit card mailed or a check in the mail. And, we suspect that some of the racial disparity is perhaps explained by the fact that, as been studied elsewhere, Black Americans have generally less access to mainstream financial services. So how we deliver these funds really matters. Next slide, please. So it's worth taking a moment to talk about the first economic impact payment, which went out to most people in April, so quite a while ago. We were asking throughout that time who had received it. The last time we asked was in November. And at that point, still 15% of people had not received the first payment. Most of them were unsure why. As you may know, the remedy for having a missing economic impact payment is to receive it through your taxes, filing your taxes. Unfortunately, people that we survey aren't really well positioned to get that missing payment through the tax system. When we asked them this in December, only 45% actually planned on filing their taxes. this year around now. 30% weren't planning on filing. A quarter were not sure. Previously, the majority of people we surveyed did their taxes themselves online. Many second in responses use the paid preparer. It stands to reason that's going to change in a moment of more economic hardship. And it looks like there are also barriers to people maybe using free tax preparer under the new circumstances we're in. You know, this would have to be generally by phone or online. Next slide. So unfortunately, they're not in a great position. However, you may have heard us mention this before. Within the FreshEBT app, something that's new that's been a result of the coronavirus pandemic has been to have a benefits update center, which people can see in the home screen when they open up the app. And this is where we share information on when there are new programs, when programs are being expanded. You know, as you know, this is changing day to day, so it's really valuable that people can see where things stand at this moment. Through this benefits update center, we are sharing information on how people can file their taxes and where they can do it for free. And this is mainly directing people in terms of free tax filing online to the Get Your Refund project from Code for America. Next slide, please. So moving on to the question of borrowing. Month after month, we ask people if they've had to borrow money or use credit to cover their expenses in the previous 30 days. Those are very high numbers. It's down a little bit since the peak in December, but still 57% of people are having to do this. We dug down for the first time to see where people are borrowing from. And overwhelmingly, people are borrowing from their personal network, family and friends. This is something that I believe Stacey has noted before, but essentially when the social safety net doesn't provide for people, the social safety net that has to emerge is from their personal networks. And it's a network that's already very taxed. It's what people rely on for not just borrowing money, but also for sharing food, for child care. If you can take me to the next slide. I guess there's one thing that I wanted to note in the previous slide, sorry, but that there's also a racial disparity here, and just in terms of who's borrowing from where. Black respondents tend to rely more on their family and friends and even less on credit cards. That is, again, kind of pointing to maybe being left out of mainstream financial services. Okay, next slide now. Thank you. As always, we ask a couple of open-ended questions in the survey, and there's really important stories that emerge from that, and we want to share people's own experiences in their own words as much as possible. And you know, we ask people, how have you been helped, or how have you helped others during the pandemic? And in that question, in those responses, we get some of this undercurrent of what it means to borrow from your personal network, the ways in which that strains relationships, perhaps, or really there are limits to it because your personal network is also struggling. I'll let you read these to yourself. And next slide. In addition, as I mentioned, these are the same people that individuals are relying on to make their food last through the month, who they're relying on to take care of their children when they need to work or look for work. Something that was kind of surprising to me in these responses is it's not just family and it's not just friends, but it's also coworkers who are helping one another and are very generous with one another, which to me is surprising. It's less of a strong relationship perhaps, but it suggests that people who are in similar economic circumstances, perhaps struggling with the same sorts of challenges, have a great deal of empathy and step in to help one another. Next slide. So Finally, we asked for the first time, as we mentioned at the beginning, how the way people are eating or spending their SNAP benefits has changed since the pandemic. We were seeing in some of these open-ended responses, time after time, individuals mentioning that it was hard to get enough food because the price of food had gone up since the pandemic started, and in addition to struggling with maybe empty shelves at the grocery store. So in asking how people are spending SNAP differently, the top response is that they can't buy as much as they could before. People are also buying less healthy food, more packaged food, and generally just have less choice perhaps. They're not able to buy the brands that they would like to, or they don't have a choice in what they get because they're relying on food pantries. We also ask people every month how much they spend beyond their SNAP benefits, in cash on food per month, and I'm sure it's not a surprise to any of you, but it's very high and it remains very high. Over 50% of people are reporting spending $100 or more a month, which leaves less for the rest of their expenses. Next slide. So we also asked people, what would an extra $50 per person in SNAP per month mean to you? This is kind of an arbitrary number, but trying to get some insight into what people would be able to purchase, how that would change things for them. And the next few slides have some people's responses. Generally, they kind of grouped into, I could eat healthy, I could have more fresh food. And this also kind of led into lots of people responding that they weren't eating according to their health needs. And the way that they were being forced to eat is detrimental to their health. Another group of people, other responses, gathered around how expensive things were now, that if they had even just $50 extra per person, they could have a guaranteed 2 or 3 meals a day for the whole month. Other people, talked about how it would still not be enough. A lot of people also talked about being able to buy in bulk more and reduce trips to the grocery store if they got more in SNAP per month. And of course, getting more would free up cash to spend on other important essential items. And finally, I, in conversations where we're focused on the pandemic as an economic crisis, we can sometimes lose sight a little bit, or it always is important to be reminded that this is still primarily a health crisis, and one in which there has been an enormous loss of life, which we've all been reminded of, having reached the milestone of 500,000 COVID deaths since the start of the pandemic. And like I said, we ask pretty narrow, open-ended questions, but many people month after month pour out a lot of their personal stories to us. And what comes through often is not just dealing with the enormous burden of this as an economic crisis, not being able to eat, losing your housing, but people are also on top of that dealing with the loss of loved ones. If you can take me to the next slide. And I'll leave you with this to read about some of the respondents' experiences.
So Julietta, these are tough reads. And I'm sure it was tough information for your customers to share, and for you to aggregate. So we appreciate your sharing it. We know it's just one more piece of how we're able to assess what policymakers should be, keeping front and center. It's just one of the ingredients, but we appreciate your sharing this. We're starting to to see some questions come in, and one of them is has to do with the benefit update status, that new feature of the app. And the question is how frequently you see customers using that function. Do you notice any particular upticks in that function as they get more familiar with it, or as something happens in the policy world that makes news and may spark them to seek more information? Just wondering what, if any, experience you're having with that new feature.
I think I'll let Stacey answer that.
I'll jump in on this one. So the Benefits Update Center has become the most utilized feature in FreshEBT, I guess next to the balance information, which is automatic for anyone who opens up the app. And second to that is the Benefits Update Center. So the vast majority of households who open up FreshEBT go into the Benefits Update Center. We do see upticks when there are new recovery plans passed or new discussions in the news. We also know that with things like the 15% boost and emergency allotment and PEBT, households track for a long time that this has sort of been approved at the federal level, and states are working on implementation and tracking really closely, when am I going to see this on my card? And it can be really confusing from the recipient side of benefits are often dispersed not at the same time. So we get lots of questions from folks about, like, I've received 5 separate benefits today, all labeled food deposit. Like, I don't know what is PEBT versus max allotment. How do I know if I'm receiving the correct amount, either to advocate if I haven't received the amount that I should be, or to make sure that I can feel comfortable spending the benefits. I'm not going to be asked to repay them. And the Benefits Update Center doesn't answer all of those questions, but helps to distill some of the policy complexity. So we certainly see uptick in use of that when sort of new policies are being implemented. We also see uptick in use around the economic impact payment as that benefit is released as well. So sort of a big yes to all of those questions.
Wow. And a question in terms of the free tax preparer. So is it your sense that those free tax preps are being done now online and by phone and not in person? It looks like, that service, which has been perhaps useful to clients in prior times, isn't attractive right now, given that it's not in person.
That's right. So we sort of were trying to get a sense of folks, are you planning to change how you have your taxes prepared this year? And at the same time, the industry pivoted, right? So a lot of the sites that had been providing an in-person service transitioned to providing it virtually through Zoom or through sort of an asynchronous phone call and then work and then back in touch. And the Vita sites had to pivot in real time last spring. So have sort of half a tax season of practice, I guess, or of real-time implementation. And then there's a tool called Get Your Refund, which has helped to aggregate some of the Vita sites and to help Vita sites transition to a virtual format. And that's what we connect households to. And so as we connect households to Get Your Refund, they get connected to either local Vita sites or Vita sites that serve a national population and can choose if they want what type of service they're looking for. We also connect folks to the IRS tool, which gives the sort of whole array of free tax preparation options, as well as some of you may be familiar with EITCoutreach.org, which also provides information about the EITC calculator and access to supports to file taxes at no cost.
So Stacey and Julietta, your series has been very informative about the need for cash assistance. That, of course, SNAP is playing an important role, but even with SNAP benefits, whether they're getting these additional PEBT and so forth, that there's still needing to pay for, take other resources to pay for food, but that they're also having to juggle. And I was struck by the slide that talked about 14% reporting that they hadn't been able to afford their prescriptions in the prior 30 days. So as we're thinking about the trade-offs that families are facing, I'm wondering if you are seeing any more insights into whether or not they're getting more work than they had at the beginning of the pandemic, whether they may be getting the vaccine, and whether, where some of these financial pressures are most acute. Is it, we know that we've always seen in the SNAP cohort that these are not always good jobs. Even when people have jobs, they may not be sustainable living wage jobs, and they may not be sufficient hours. But I'm wondering if you're planning to look more at their work situations, job situations, and ability to get the vaccine, perhaps in future months.
I can hop in on this as well, and Juliette, I'll give you time as well. It's great that you're asking about the vaccine question. We've been talking about that a lot internally, about how and when and if to ask folks explicitly about the vaccine, about vaccine access, about trust of the vaccine, and also if we have the capability and the right connections to share information about vaccine access. So if folks have ideas, suggestions, partners, please do let us know. It's something that we're actively exploring. We have tracked work a little bit. I think in the last webinar, now I'm not sure, may have chatted about that we're starting at the time, and Juliette, I'll let you weigh in on this survey as well, to hear folks had access to jobs, but not good jobs and not enough hours. So a lot of stories around like, yes, I've gone back to my employer, or I found a new job, but the hours are spotty, or they're nowhere near what they used to be. And that's a huge challenge, as you'd imagine.
Yeah, I think in December, right, what we revealed was that there was a lot of focus, rightly so, on the expanded unemployment benefits, but really that was only reaching a fraction of the people of our users who we survey. In general, there were more people reporting that they had lost hours than had lost a job. And I can, just quickly kind of give a few numbers in terms of, in the past 30 days, in January, when we asked this, more people had lost, again, hours than had lost a job or started a new job. And overwhelmingly, again, more people, about the same amount of people, lost or quit a job or had their wages cut since March 2020. About a quarter of people. And, only maybe less than 10% had started a new job. So.
Yeah. And a thanks in the Q&A for lifting up both the racial disparities, the disparities for households with children, but also some of the insights that you offered about why that might be in terms of the stimulus payments and why there might be, what are some of the systems issues with how those are distributed and how people have access to bank accounts and other things. So appreciate those insights, and I think we're close to at time. So we'll capture any other Q&A and do some follow-up and share those with you. But again, thank you so much for the insights. Again, it's tough, very tough information for your customers to share. They've been very generous to share that. We appreciate the fact that they would like to have the information shared. So thank you, and thank you for bringing it to us. It's certainly a reality check. Nomi, I'll let you close it out.
Thank you all once again for joining us. Have a great rest of your day.